High cholesterol and fatty liver. How are they different? Treatment and diet. Tips. After 50. Dear friends, according to the latest statistics from the World Health Organization, nearly 1/4 of the global population is living with fatty liver disease, and more than 39% of adults struggle with high cholesterol. What's even more concerning is that many people discover both problems at the same time: elevated blood lipids and fatty liver on the very same test results. And immediately, a familiar question arises. Are these just two names for the same disease? Or are they truly different conditions? The answer is they are completely different. But they are also closely connected. High cholesterol silently damages the heart and blood vessels, while fatty liver gradually weakens the liver itself. And when both occur together, the risk of complications multiplies. In today's video, we'll take a clear, science-based look. The difference between high cholesterol and fatty liver, why they so often appear together, the signs you should never ignore, and, most importantly, how to eat, treat, and prevent these conditions to protect your heart and liver health after age 50. Part 1. What is high cholesterol? Friends, when we talk about high cholesterol, doctors often call it dyslipidemia. We're really talking about fat levels in the blood that have climbed higher than they should be. There are 4 key numbers every adult over 40 in America needs to know. First is total cholesterol. A healthy level is under 200 milligrams per deciliter. Between 200 and 239 is considered borderline, and 240 or higher is too high. Second is LDL cholesterol, often called the bad cholesterol. This is the type that sticks to artery walls. Ideally, it should stay under 100. Between 130 and 159 is borderline high, 160 to 189 is high, and 190 or above is dangerously high. Third is HDL cholesterol, known as the good cholesterol. Unlike LDL, the higher the better. Men should aim for above 40, and women for above 50. When HDL drops too low, the risk of heart disease rises sharply. And fourth are triglycerides. Normal levels are under 150. At 200 and above, they're considered high. Once they reach 500 or more, the risk becomes serious, because that level can trigger acute pancreatitis. The most dangerous thing about high cholesterol is that it's usually silent. There are no warning signs. Many Americans feel perfectly fine. Yet inside their arteries, fatty plaques are building up, slowly narrowing blood flow and setting the stage for heart attack or stroke. Take this example. A 55-year-old man in Ohio felt healthy, except for an occasional headache. But when his blood work came back, the numbers told a different story. Total cholesterol at 245, LDL at 165, triglycerides at 210, and HDL only 38. This was a textbook case of high cholesterol, putting him at serious risk for hardened arteries and stroke if he didn't change his diet and lifestyle right away, and he is far from alone. According to the Centers for Disease Control and Prevention, heart disease is still the #1 cause of death in the United States, with high cholesterol playing a major role. The American Heart Association estimates that nearly 94 million U.S. adults have borderline or high cholesterol, most often tied to diets heavy in red meat, fried foods, processed snacks, and too little daily movement. Part 2. What is fatty liver disease? Unlike high cholesterol, which is measured in the blood, fatty liver disease happens inside the liver itself. It's when fat begins to build up inside the liver cells. Doctors usually make the diagnosis when fat accounts for more than 5 to 10% of the liver's weight. There are 3 main stages. Stage 1. Fat has just begun to collect in the liver cells, but the liver is still working fairly normally. Stage 2. The fat spreads more widely, and it starts to interfere with the liver's ability to detoxify the body. Stage 3. The most serious stage. Liver cells are damaged, and if nothing changes, this can progress to hepatitis, cirrhosis, or even liver cancer. In the United States, the most common causes are obesity, type 2 diabetes, metabolic syndrome, diets high in sugar and saturated fat, and of course, long-term alcohol use. But here's something many people don't realize. Even someone who looks thin can still develop fatty liver if their diet is unbalanced. Doctors call this lean fatty liver disease. The dangerous part is that fatty liver usually develops quietly. Most people don't notice symptoms in the early stages. At best, there may be vague signs like fatigue, loss of appetite, bloating, or a dull ache under the ribs on the right side. But very few connect these to liver problems until a routine ultrasound or blood test shows the truth. Let me give you an example. Picture a 52-year-old woman working an office job in Chicago. She visits her doctor because she feels constantly tired and has little appetite. On the outside, her weight looks normal, but the ultrasound reveals stage 2 fatty liver. After looking at her habits, the doctor discovers that she drinks soda almost every day and rarely exercises. The daily sugar overload was silently fueling fat deposits inside her liver. Even though she wasn't overweight, according to the American Liver Foundation, about 1 in 4 U.S. adults now has non-alcoholic fatty liver disease, and the number keeps climbing. That's a serious red flag, because if it's not caught and managed early, fatty liver can quietly advance to dangerous and often irreversible stages. Part 3. Comparing high cholesterol and fatty liver. To avoid confusion, let's make the difference crystal clear. High cholesterol means there's too much fat, mainly cholesterol and triglycerides, circulating in the bloodstream. These fatty particles stick to artery walls, forming plaques that gradually narrow blood vessels. As the arteries tighten, blood flow is restricted, which greatly increases the risk of heart attack and stroke. Fatty liver, on the other hand, is very different. Instead of floating in the blood, the fat gets stored inside the liver itself. Over time, the liver becomes heavier, less efficient at breaking down toxins and processing nutrients. If fat keeps building up, it can trigger inflammation, scarring, cirrhosis, or even liver cancer. But here's the important link. Both conditions often grow from the same roots: too much saturated fat, refined sugar, alcohol, and too little physical activity. That's why someone with high cholesterol has a higher chance of developing fatty liver, and someone with fatty liver is more likely to also show abnormal cholesterol levels. Still, it's possible to have one without the other. For example, picture a 60-year-old man in New York with cholesterol at 2i50 and LDL at 170. That's clearly high cholesterol, yet his liver ultrasound looks perfectly normal. Now consider a 50-year-old woman. Her scan shows stage 2 fatty liver, but her cholesterol numbers are still within the healthy range. And that's the key lesson. High cholesterol and fatty liver are two separate conditions. They often overlap, but they are not the same thing. Understanding that difference is the first step to managing and preventing them more effectively. Part 4. Treating high cholesterol. Friends, the very first and most important step in treating high cholesterol is not medication. It's lifestyle change. Start with what you eat. Cut back on saturated fats and fried foods. That means less red meat, fewer processed meats like bacon and sausage, and avoiding poultry skin and deep-fried foods. These are the main culprits that drive up LDL cholesterol, the bad kind that clogs the arteries. Instead, choose heart-healthy fats. Swap butter and lard for olive oil, avocado, or nut-based oils. Pick lean chicken or fish instead of fatty. Cuts of beef or pork. Make fatty fish a regular part of your meals. Salmon, sardines, and mackerel are rich in omega-3 fatty acids. These healthy fats lower triglycerides and help calm inflammation in blood vessels. Add fiber-rich foods to your diet every single day. Oats, beans, lentils, apples, and flaxseed provide soluble fiber. Fiber acts like a sponge, binding to cholesterol and helping your body flush it out. The American Heart Association strongly recommends these foods for anyone managing high cholesterol. And do not forget movement. Just 30 minutes of brisk walking, cycling, or swimming each day can raise HDL, the good cholesterol, and help your body burn off excess fat. In more serious cases, when lifestyle changes alone are not enough, doctors may prescribe cholesterol-lowering medications. The most common are statins. These drugs lower LDL cholesterol and help prevent plaque buildup in the arteries. But here's the key point. They must only be used under a doctor's supervision. Taking them on your own can cause side effects and do more harm than good. Let me give you a real-life example. A 58-year-old man in Florida went in for his annual checkup. His total cholesterol was 280, and his triglycerides were 260. Instead of prescribing medication right away, his doctor advised him to change his diet and walk every day. 3 months later, his numbers dropped dramatically, without a single pill. That is the true power of healthy living. Part 5. Treating fatty liver. When it comes to fatty liver, the foundation of treatment is weight management and diet. Research shows that losing just 5 to 10% of body weight can significantly reduce fat in the liver and improve how well it functions. The first rule is to eliminate alcohol completely. Beer, wine, or liquor. It all forces the liver to work overtime and speeds up fat buildup. For someone with fatty liver, even small amounts can make the condition worse. Next, cut back on processed foods. Stay away from deli meats, packaged snacks, frozen pizzas, and canned soups. These are loaded with preservatives, sodium, and unhealthy fats that place extra stress on the liver. Instead, load up on vegetables and plant-based foods. Leafy greens, broccoli, and whole grains like oats and quinoa are rich in antioxidants and fiber. They help the liver detoxify and stay strong. Choose healthy proteins. Beans, lentils, tofu, fish, and lean chicken provide the nutrients needed to repair cells without overwhelming the liver with saturated fat. And switch to healthy oils. Olive oil, sesame oil, and canola oil are unsaturated fats, much easier for the liver to handle compared to heavy animal fats. Exercise is just as important as diet. Light but regular activities such as walking, yoga, resistance band exercises, or swimming help burn fat, improve circulation, and lower stress levels, which all support liver health. Let me share an example. A 54-year-old woman in Texas was diagnosed with stage 2 fatty liver. She had no clear symptoms other than fatigue, but her liver enzymes were elevated. With her doctor's guidance, she cut out alcohol, reduced soda and sweets, walked for 30 minutes each day, and lost 15 pounds over 6 months. At her follow-up, the ultrasound showed major improvement, and her liver enzymes returned, close to normal. And one more thing, regular checkups are essential. Blood tests and ultrasounds allow doctors to monitor progress and catch problems early. With discipline and the right lifestyle changes, fatty liver doesn't just improve, it can actually be reversed. Part 6. What to eat and what to avoid. To make this simple, let's divide foods into 2 groups: what to eat more of and what to avoid. Eat more. First, fatty fish like salmon, sardines, and mackerel. They're rich in omega-3 fatty acids, which lower triglycerides and protect your arteries. Second, oats and whole grains. These are high in soluble fiber, which helps flush LDL cholesterol, the bad kind, right out of the body. Third, seeds like chia and flax. They provide plant-based omega-3s and fiber, offering protection for both the heart and the liver. Fourth, leafy greens and cruciferous vegetables like broccoli. They're loaded with antioxidants and vitamins that support the liver's natural detox process. And fifth, low-sugar fruits such as apples, grapefruit, and berries. They deliver fiber and vitamin C without spiking blood sugar. Avoid. Now, let's talk about the foods to avoid. Fatty cuts of meat, poultry skin, and organ meats. These are loaded with saturated fat and cholesterol that drive up blood lipids and strain the liver. Fried foods and fast food. They often contain trans fats and oxidized oils that damage arteries and overload the liver. Alcohol. Even small amounts damage liver cells and make fatty liver worse. And finally, sugary drinks and desserts. Sodas, pastries, and candies are full of refined sugar, which the liver quickly converts into fat. Here's the good news. Even just a few months of consistent healthy eating can lower cholesterol numbers and reduce liver fat. Small steps, practiced every day, really do add up to big improvements in health. Friends, as we've learned today, high cholesterol and fatty liver disease are not the same condition, but they are closely connected. Think of them as two links in the same chain of metabolic imbalance. If left untreated, both can lead to serious complications, heart attack, stroke, cirrhosis, and even a shorter lifespan. But here's the good news. With the right choices, both conditions can be controlled and in many cases, even reversed. Remember these 4 golden rules. First, eat a balanced diet that supports both heart and liver health. Second, exercise every day. Even just 30 minutes of walking makes a difference. Third, avoid alcohol completely, because even small amounts can cause harm when these conditions are present. And fourth, get regular checkups and follow your doctor's guidance closely. These are the keys to keeping your heart strong, your liver clean, and your life healthy well beyond age 50. If you found today's video helpful, please give it a like, share it with a friend, and subscribe to LifeWell Daily, so more people can benefit from trustworthy health knowledge. And we'd love to hear from you. Would you like our next video to focus more on cholesterol management or on fatty liver reversal? Your comments help us shape content that truly meets the needs of this community.